Okay. Welcome to our press conference. My name is Ren Bradley. I'm a social work supervisor in Child Protective Services and one of the vice presidents of SEIU 521. As you know, we have been on an unfair labor practice strike across the county over the reorganization of the Department of Family and Children's Services that started on October 2nd. We are glad to announce that our strike has resulted in significant improvements for the children and families that we as county workers serve every day. Different age groups are now being separated at the Receiving and Assessment Intake Center. That's where we take children when they're removed from their parents. This is improving the safety conditions of the children. Also, the County Board of Supervisors this past Tuesday, the 22nd, halted the closure of the San Jose Family Resource Center while looking for solutions to address the needs of underserved families in East San Jose. Today, we are here to announce that we will strike again. This time, thousands of employees across the county are committed to strike to demand that the county immediately stop the unfair labor practices that's occurring at O'Connor Hospital, St. Louise Hospital, and DePaul Urgent Care Center. And I want to recognize RNPA because they've been with us every step of the way at every strike line that we've been at in Santa Clara County. Now, when the County of Santa Clara acquired O'Connor and St. Louise Hospitals, management promised continuing employment and the stability of patient care that it would bring. Now the county is making promises but refuses to negotiate in good faith with our SEIU 521 members over these promises and to make them enforceable. You'll be hearing directly from our members on these issues. Now I would like to introduce Blanca.
O'Connor Hospital, and I enjoy assisting our patients in our community. Our patients are the people who inspires me to continue with this career in the healthcare. As the months have passed since the acquisitions of the hospital by the county, I have experienced nothing that false promises from management. We were promised our jobs were secure, and we believed them, only to find out later that this may be another false promise. I depend on my job to provide for my family, and I also, as a cancer survivor, I also depend on my health insurance. It's not easy carrying all this stress knowing that my job depends on the test that I may not pass, or even if I pass, it may not have the desired score to hold my position. I know that I have more than 12,000 county workers who are ready to go on a strike for unfair labor practice to get this issue resolved. We deserve to be respected as a community, and as a county resident, we deserve to hold our positions here. I'm supporting my co-workers, O'Connor and St. Louise and DePaul. Thank you.
And now I'd like to introduce Victor Rios.
Hello.
Hi, Victor.
Good. Okay, my name is Victor Rios. I'm a full service worker. I have worked at O'Connor Hospital for 15 years. This March, I became an employee of Santa Clara County. I was assured by county management my job was secure. I wish I could say I have ever felt it was the truth. I wanted to be able to trust management. I wanted to believe hospital CEO Paul Lawrence and CEO Jeff Smith. They present themselves as honest and trustworthy men. But I became nervous when my co-workers started taking the test and failed it. Then I got really scared when they started receiving 90-day notice. Once we started standing up for ourselves, Jeff Smith came to our hospital and promised all the workers we could tear up our 90-day notice. But when this proposal went to the board to fix this issue, it did not count for all the test failures. It did not count for mine. Today I'm still unclear if I have a job next year. I live with my wife, my 2 daughters and son, and my brother-in-law, family as well. To cover our rent, we all must work. If I lose this job, I will harm my family's ability to have a job, to have a home. I wonder if this was the last time Jeff Smith failed, he might lose his home. For decades and a half, I have provided nutritious meal to some of the sickest people in Santa Clara County. What is that worth? To my co-workers and to my family, it means a lot. To the county management, not too much. But I'm standing here with my co-workers to say that enough is enough, and I'm tired of that disrespect, half-truth and delay. We must take action on an unfair labor practice strike. Together, we know we can, with my co-workers, we can win. Together, we can gain dignity and respect. Thank you.
I'm calling Jessie Karzine to the podium.
Yes, okay. Good morning and good afternoon. I'll see you tonight. Good evening. My name is Jesse Kazine, and I have worked at O'Connor Hospital for the past 15 years as an OB tech in labor and delivery. It's been a life honor to serve the patients in the most precious times of life. However, on March 1st of this year, I was told by Santa Clara County that I could no longer do that. I was misclassified as an operating room clerk until June 15th. For months, I was shortchanged on my pay, my dignity, and my ability to serve patients. Today, we still have workers at the hospital here that are misclassified, doing the wrong work, and being ignored. I was made to think that this would be a priority by the county, but clearly it wasn't. After months of doing both desk work and parts of my tech work, I inquired whether I would receive back pay for the county's mistake, and I was told no. For many of my co-workers, this pay difference is the difference between paying and not paying rent. The difference between staying at O'Connor because we love it and leaving it because of being demoralized. I am proud to say that I'm still at O'Connor. I am sad that so many of my longtime co-workers have left. Friendly faces that I've known for years have gone. Suddenly gone because of the communication breakdowns, the disrespect, and the utter chaos that has been going on, and it's too much to handle at times. What's sad to me most is that though the patience is what they have lost. It breaks my heart at times that with so many years of experience that someone new would come in and serve the patients. There's nothing wrong with traveling nurses and techs. Nothing wrong with that at all, but for the workers that have been here for years to be ignored, to be stepped aside, people who serve this community for years. There's families that come in and out of this hospital that are on their fourth and fifth child, that see faces, familiar faces in this community, but all of a sudden they don't know the faces. All of a sudden they don't know who's taking care of them. The quality is, went down a little bit because of things like that. That's all I have to say. I just want to say thank you. Thank you for your time.
Good afternoon, everybody. My name is Carlton Allen. I have been with Santa Clara County for about 14 years as an LVN. I have had the honor in being in this county and staying here and not going to other places because this is a great place to work. But as you have heard from Blanca, Jesse, and Victor, and many others right behind me who are not speaking, the county's illegal and unilateral changes in job requirements and working conditions at the acquired hospitals have all contributed to a deteriorating situation for our hospital workers that puts our hospitals, our patients, our community at risk. Management claims hospital workers at the acquired hospitals aren't qualified, even though from 1 year to some time since 1979, these workers have been doing these same jobs without fail, without any problems, and the management still claims they're not qualified. Our co-workers are scared, angry, and frustrated, sometimes one, sometimes all of the above, because of broken promises by this county to them. As a result, and it's sad to say, people are leaving. They're thinking about leaving. We are putting the health of our underserved patients at risk when skilled workers leave, which is contributing to increased short staffing. It's a crisis because my co-workers and for our community that relies on these hospitals to stay open. The county taxpayers who have invested so much in the acquisitions of these hospitals deserve a lot better. As we have learned from our strike over unfair labor practices at the Department of Family and Children's Services, strikes do get results. On Wednesday night's town hall, and again at Thursday's membership meeting, workers from across the county voiced overwhelming support for taking all actions necessary and up to an unfair labor practice strike to make the county stop breaking the law and start respecting their rights. When management lies to our union members, including Jeff Smith, that lied to them, but lied to them to their face. You're going to have a job. That's a lie. They break promises made to members. Management refuses to negotiate over our working conditions. They aren't just hurting workers, they're hurting the hospital, they're breaking the law. And by famous labor relations, they're not interested in it. So it is our right as public employee workers in the state of California to strike when management can commit serious unfair labor practices, and that is the exactly what we plan to do. We need to strike to stop the unfair labor practices and go back to doing our job as healthcare workers in this community. Are you with me? Yeah. Are you with me? Yeah. And if we don't get it, what do we do? Shut it down. What do we do? Shut it down. And if we don't get a contract, what do we do? Shut it down. Thank you.